During the national budget reading, Finance Minister Matia Kasaija announced that 5.87 trillion shillings has been allocated to the health sector for the financial year 2025-2026. Key priorities include functionalizing health centers, strengthening primary health care and community health services, and scaling up national e-health infrastructure, among others. While this figure represents an increase, it still falls short of the Abuja Declaration that calls on African Union member states to allocate at least 15% of their total national budget to health. According to the Ministry of Health, 1.3 trillion shillings will be spent on wages, another 1.37 trillion on non-wage, and about 421.3 billion on development, among others.
The health sector has received a slight increment based on the figures that we have. We'll have 4.4 trillion for the sector that is spread across a number of health sector votes. Those are health sector institutions.
The Ministry of Health itself takes a big portion of this budget, increasing from 1.3 trillion in financial year 2024-2025, that is soon ending, to 1.56 trillion in financial year 2025-2026.
And this is meant to enable us do a number of activities. There is some increase, mainly to support the refurbishment of a number of the general hospitals like Kambuga, Masindi, Bujiri, Koboko, Muko for Rwanda. We have also some facility in Katakwi and also Ruwero Hospital. These have ongoing projects that have been done incrementally, and we have received more funds to ensure that we do more work on their upgrade and refurbishment.
Other major allocations include local governments, which has been allocated 1.2 trillion, up from 1.1 trillion shillings. National medical stores at 717.6 billion, a slight decrease from 721 billion shillings, despite frequent reports of stockouts in health facilities. Uganda Cancer Institute budget increased from 129.9 billion to 226 billion shillings. Mulago National Referral Hospital, Uganda Heart Institute and others. While they remain key recipients, some of these entities have experienced funding cuts compared to financial year 2024-2025. Despite some increases, stakeholders say many of these institutions still receive less than what they require to meet public health needs.
Of regional hospitals. This is a project that has been there for the last 15 years and has never ended. Simply because the amount of money required, we have not even able to spend 10% of that. Every time we just put little, and yet the amount of money required is so huge. So by saying that we should do one for all, some for all, has really delayed the completion of the regional hospitals. That's why some of them are dilapidated. Some of them have got theaters that are not functioning.
The health sector continues to face major unfunded priorities, especially the recruitment of health workers. Although the country has trained professionals, many remain unemployed due to insufficient budget provisions for recruitment.
Mulago, which is a national referral hospital, has a very small staffing level. They requested for 28 billion to cater for recruitment of nurses. These are critical staff. A doctor will spend with you say 2 hours while operating you in the theater, that is the specialist, but the rest of the time in your hospital is spent with the nurse. So for Mulago, that is an unfunded priority. That money they are not getting. And it's not only for Mulago. Kabale, which has staffing levels of 12%, requested for money to up their staffing levels. That money was not given.
Some of the entities in the health sector that are receiving less money are Uganda Virus Research Institute, that has been allocated 9.3 billion, up from 7.1 billion shillings a year ago. Soroti Regional Referral Hospital, 11.8 billion shillings, down from 11.9 billion shillings. Yumbe Referral Hospital is allocated 13.5 billion shillings, up from 11.7 billion allocated in the 2024-2025 financial year. Dr. Timothy Batua, the Shadow Minister for Health and a member of the Parliamentary Health Committee, says many of these hospitals continue to struggle with unpaid utilities and other unfunded needs.
The other area is the National Ambulance Service System. This one has not been given money for fuel. It has not been given money to maintain the fleet that they have. So challenges cut across all the referral hospitals, because this is where we need where we need ambulances. This is where the specialized care is.
Invest more in the prevention rather than cure. And you can be told very well that during COVID, flu and the cough almost went away simply because we promoted hygiene. And it is something that the government is not investing in so much. Instead, we want to invest in hospitals.
Over the years, Uganda's health sector has relied heavily on external financing, yet the budget is still counting on external funding. According to experts, the 2025-2026 budget does not address these donor cuts.
The current budget has not taken into the consideration that you said that was funding almost 600 billion to the health sector. Actually, we withdrew. So there is going to be a serious gap in terms of health service delivery in this country.
The legislators add that the little money being allocated to the health sector is not efficiently utilized.
I would not worry donors leaving. I think my worry is that the little money we are not utilizing it efficiently. You cannot have a project in the Ministry of Health for 10 years. You cannot build a hospital for 10 years, for example. Simply because that at the beginning of the project you are not prepared to have it in the first place. You never had a visibility study.
Nobert Atukunda, NTV Weekend Edition.